Hi, I'm Dr. Kyle Gears, and this is another episode of Thursday Brain Bytes. So previously we've been talking about the cells in the brain and the different parameters that can be recorded with neural activity and implanted extracellular electrodes. We then talked a little bit about how these cells in the brain respond to having electrodes implanted in terms of an injury response and how that can affect our neural recordings. So we're going to take a step back into kind of the physics and engineering world next and talk briefly about how we actually puncture brain tissue and what are the consequences of sticking something into the brain from a mechanical perspective. So as we look here on the board, we actually have kind of a few drawings that investigate from publications that are investigating how tissue puncture happens and how things such as insertion velocity can affect how the tissue responds to electrode insertion. So what we usually see is if you're inserting an electrode, you're putting a vertical force onto your tissue. At some depth, you cause the tissue to deform, and this causes the dimpling that we're all familiar with. At some point during this dimpling, you have a crack that forms, and so this is a rupture in the tissue that encompasses our inserted device. And so it never is perfectly matched to the exact size of your electrode. It's almost always a little bit larger. And this occurs at some force where the force of puncture is less than the force of indentation, and the work being performed is actually what is the dictating factor. So in this case, you have tissue puncture at the point where the force and the work to continue to indent the tissue becomes less energetically favorable to rupturing the tissue and causing that crack to open. So in a different study, a group then investigated how does the CSF or how does fluid in a porous medium influence force dissipation at different strain rates. And what they're able to show is that at a slow strain rate, the volume of tissue where the fluid is displaced is larger at slower strain rates compared to faster strain rates. So in the brain, you would think about this as the amount of CSF displaced around our tissue. And so if you're inserting slowly, you displace more CSF. This leads to increased tissue dimpling compared to something like a faster strain rate. So if you insert your probes quickly, you displace less CSF and you would see less tissue dimpling. So kind of schematically looking at this, what happens is at a fast insertion rate, you have a large volume of tissue that is undrained. Only the tissue right at the tip of your crack propagation is what is being drained of CSF, and so there's not much displacement. However, at a slower strain rate, you would see more drainage of a larger tissue volume, and this can lead to then the collapse of your cellular structures and that damage response that we were talking about. So I'm Dr. Kyle Gears, and this has been another episode of Thursday Brain Bytes.